In the last issue we talked about cosmetic solutions to help cover up hair loss. In this issue, we are going to talk about diagnosing and treating female pattern baldness. Baldness generally occurs when hair falls out and new hair doesn't grow back in its place. The cause of female pattern baldness, androgenetic alopecia, still isn't completely understood. Studies show that it may be related to aging, changes in hormone levels. For example, after reaching menopause, many women find that the hair on their head is thinner, while the hair on their face is coarser. Pattern baldness in women usually occurs during the latter part of middle age. It appears as the gradual thinning of hair over the frontal area. Usually, pattern baldness in women isn't accompanied by a noticeable increase in hair loss. The scalp simply becomes more visible as the natural shedding process occurs and new hair doesn't grow back. Most of the time, the central part of the head widens due to diffused reduction of the hair's density, which involves the frontal scalp and crown. Some women may experience hair loss on some small areas of the frontal scalp, while others may experience the effect on the entire scalp, including the areas of parietal and occipital. During hair loss, women usually retain a rim of hair along the frontal hairline. In some cases, hair volume may still appear normal, but the hair will stop growing to its previous length and normally results to thin distal ends. For this type of hair loss, there are treatment options available both over the counter and by prescription. Of course, every product has their pros and cons, and in some cases, only small improvements in hair density can be seen. Advanced pattern baldness can be difficult to treat. It's important to seek treatment as soon as possible before irreparable damages occurs and may have already taken place on the follicular stem cell, especially when inflammation surrounds the bulge area of the follicle. Treatment plans for this type of hair loss include minoxidil. Treatment with minoxidil Rogaine targets the hair follicle. It slows or stops hair loss and promotes hair regrowth. It's available over the counter for the treatment of androgenic alopecia. It's clinically proven effective in the prevention of hair loss and in establishing varying degrees of hair regrowth in both men and women suffering pattern baldness. Keep in mind that it must be used indefinitely to support existing hair follicles and maintain continued hair regrowth. Finasteride. Treatment with finasteride, brand name Propecia or Proscar, has been effective on men with pattern baldness but proven to be risky for women. This regimen isn't recommended for women, especially those who are still in their childbearing years. Hair transplants. This is another option and is widely accepted as a treatment for most types of pattern baldness on men. Now, it's also being used to treat female hair loss, although only a very few women go for this type of treatment because of the cost and the possible trauma that goes along with it. Make sure you look for your next issue soon. We will be talking about how the lack of iodine and silica and how it can affect your hair.